Hello, my name is Allison Weiss, and I did my Capstone drug project on pantoprazole, or better known as Protonix. So, pantoprazole is an anti-secretory drug that treats gastric acid conditions that are caused by hyperacidity. So, some clinical conditions that are indicative of taking Protonix include gastroesophageal reflux disease, erosive gastritis or esophagitis, Zollinger-Ellison syndrome, and short-term treatment of active peptic ulcer disease and duodenal ulcers caused by H. pylori. The stomach basically produces too much acid during those conditions, and it causes heartburn and damage to the esophagus. Protonix can also be used to prevent any further damage that's already been done, and the drug class of pantoprazole is a proton pump inhibitor. So, pantoprazole does not have anticholinergic or histamine 2 blockade properties such as a medication like Pepcid. Protonix reduces hydrogen secretion by the inhibition of the hydrogen potassium adenosine trisphosphate enzyme system, which is also, that's just a fancy word for the proton pump system. So the proton pump system is at the secretory surface of the parietal cell itself, and it blocks the final step of hydrogen secretion. It reduces gastric acid by 90%, and it increases serum gastrin levels. It decreases gastric production for approximately 72 hours after each dose, which is a good thing. And upon discontinuation of pantoprazole, it takes about 3 months for gastric acid secretion to rise back to pre-treatment levels. And other effects related to suppressed gastric acid secretion include decreased blood flow to the pylorus and the duodenal bulb, and it increases pepsinogen levels and decreases pepsin. Now, absorption of pantoprazole is important because pantoprazole, if not given in the right form, it can be destroyed by the stomach acid environment. So that's why they are enteric-coated, or they are granules, so they cannot be destroyed by the acid in the stomach. Once the granule leaves the stomach, it immediately begins rapid absorption. When pantoprazole is given with food, absorption can be delayed for up to 4 hours. Distribution. Pantoprazole is distributed to the parietal cells of the stomach, as we discussed in the last slide, and it can cross the placenta and it can enter the breast milk. Pantoprazole is metabolized by the CYP450, 2C19, and CYP450 and 3A4 metabolites, and others that have little or no anti-secretory activity. In hepatic disease, the half-life increases to have a high of 9 hours. The excretion, 71% is excreted in the urine and 18% is excreted in the feces. There aren't many contraindications to taking pantoprazole. One of them would be hypersensitivity to the medication. One would be having any pre-existing conditions with the liver, causing more hepatic problems and hepatic toxicity, because pantoprazole is extremely metabolized by the liver. The good news is that we know pantoprazole is generally well tolerated amongst most patients. Very small percentage, almost only 1% of patients reported symptoms such as abdominal pain, drowsiness, constipation, and diarrhea. However, with it being a GI medication, it's hard to differentiate if these are adverse effects of the medication or adverse effects or signs and symptoms of the disease process in which it's being used for. PPI studies show evidence that there is a risk for nutrient deficiencies if it's taken long term. The PPI can reduce stomach acid production and enough in the stomach that the patient is at risk for iron deficiency, anemia, calcium deficiency, and vitamin B12 deficiency. With that, this increases the risk of bone fractures and osteoporosis. So pay attention especially to females and older adults and their risk of developing osteoporosis while taking pantoprazole. Another study shows an increased risk of chronic kidney disease and acute kidney injury. PPIs may reduce the stomach's natural defense with the stomach acid to fight off pathogens, and it can increase the risk of getting C. diff or salmonella. Rarely, it can cause lupus, so monitor for joint pain, rashes on cheeks and arms, mouth ulcers, intolerance to heat and cold, and other signs and symptoms of having lupus. Pantoprazole has not been studied well or established in children for younger than 5 years of age. So some alternatives to pantoprazole includes medications such as omeprazole, esomeprazole, and lansoprazole, and they can be used for the treatment of GERD and esophagitis. And those medications have been FDA approved for ages 1 year and older. Long-term studies show that there could be an increase of respiratory and GI infections when taking pantoprazole or a PPI in a pediatric population, but there are only a few studies that show that evidence. In geriatrics, pantoprazole is extremely metabolized in the liver, so use caution in older adults, especially those with hepatic dysfunction, but no dosage adjustment is recommended. And the Beers criteria says to avoid pantoprazole in older adults for more than 8 weeks due to the risk of developing C. diff or another infection and the risk of bone density loss leading to osteoporosis. So in any of the populations, it's important to monitor liver function, especially have a baseline at the beginning and follow throughout the course of the medication, because the medication is extremely metabolized in the liver, and you want to make sure as a provider that the liver is not being affected by the pantoprazole. Also monitor for anemia and nutrient deficiencies such as iron, B12, and calcium deficiencies. And a few studies have showed that the patient taking it could have low magnesium and low calcium levels, so it'd be important to have a baseline before starting medication and follow that throughout the course. Pregnancy for pantoprazole, it is a pregnancy category C because there are few controlled studies to assess pregnancy-related events or malformations. There are no adverse outcomes that have been reported with pregnant women taking Protonix, and it is excreted slightly in breast milk. 40 milligrams a day of Protonix does not cause adverse effects in the infant being breastfed. Pantoprazole is fairly affordable. It's approximately 37 cents to $1.69 per unit, and in total, depending on the amount of pills prescribed, it's about $18.42 to $84.31. The alternative is the brand name Protonix, which is $15.21 per unit, and the total cost is about $1,369.34. So the generic is exponentially cheaper and a lot more affordable at almost 37 cents a unit. And a lot of insurance companies do cover the cost of pantoprazole. Prilosec or omeprazole is available over the counter at nearly every pharmacy, and its price is $10 to $30, and that just depends on the amount of tablets that are in each package, but those are available. So some patient education first begins with telling them to take the dose exactly as prescribed, and even if the symptoms begin to improve, they should not quit taking the medication. If a dose is missed, the patient should take the next dose as soon as possible, and they should be informed not to double up on doses. All drugs should be taken before a meal and preferably in the morning when the patient wakes up before they eat breakfast. Difficulty swallowing can be a barrier because patients who take Protonix maybe have severe erosive esophagitis. If that's the case, they need to be informed not to crush or chew the extended release tablets. PPIs may cause drowsiness or dizziness, and if mental alertness is required for an activity, just be careful with those activities, but those reports are very mild and don't happen very often. The patient should be informed to report black tarry stools, headache, and abdominal pain to their provider. And the patient should be informed that lifestyle changes can really help reduce the stomach acid being produced in the stomach. And that includes avoiding caffeine, fatty foods, spicy foods, and sugar and chocolate.